All right, guys, in the last video, what we went through is we went through a lot of the stresses, the physical, the chemical, and the emotional stresses that we're all exposed to on a daily basis. Now what I want to talk about is what does that, being exposed to those different stresses, the poor posture, the bad food, the bad preservatives, the bad chemicals in our food, the negative thoughts, the emotional stress and tension that we have, what does that do to our body physically? So you can understand what that does to your joints, what that does to your spine, and then you also understand what that does and that can set up, if it's not corrected, if it's not managed, if it's not taken care of properly, what that will set up long term in your body. And these studies right here talk about the effect of what's happening in your body due to different traumas, due to different stresses that we have that's put on our body, how it responds. So one thing that your body does with all of those different stresses, especially it's really easy to think about with physical stresses, with a trauma, with a motor vehicle accident, a sports injury, or just sitting with poor posture. As gravity compresses down on a poor posture and this poor alignment, that puts stresses on different joints all throughout your spine. So what your body does in response to that, in response to the inflammation that it creates, the strain that it creates in your muscles, your tendons, your ligaments, and your joints, is it starts to put what's called scar tissue adhesions inside, all around the disc. This is a side view of the spine where you have the disc. These are the cushions between the bones. And then there's the vertebra there, that's the actual bones. And you have the spinal cord that runs right down the middle, and then the nerves come out and go out through the entire body. But then you also have these joints in the back. But the body's response to all those different types of stresses is it'll put scar tissue adhesions, it'll lay scar tissue adhesions all around the disc, all around the joints, in the muscles, in the fascia, which is the covering of the muscles, in the tendons and ligaments, all around that area that you've been putting stress. Maybe it's from poor posture, you're putting stress in certain joints in your body. So it's putting the scar tissue adhesions in those segments, in those vertebral segments. And what that does is it acts like a cast. Like if I broke my arm and I put a cast on, that cast completely immobilizes my arm so I don't move it. What this does is when you put scar tissue adhesions, is that binds the joints down. It binds it down where it immobilizes it, where you're not getting that good motion. And remember, movement, mechanoreception, especially around the spine, is what we need to drive brain function. Because if you recall from earlier videos, 80% of baseline function of your brain is due to that mechanoreception, that mechanical movement stimulation through your nerves. So you have areas in your body that are not moving, especially around your spine. You're not driving your brain properly. You're not driving proper brain function, which then is not driving proper homeostatic function throughout your entire body. But take a look at this here. There's 4 different studies here that I want to talk to you about that help you understand why I actually recommend people get adjusted on a regular basis for their entire life, from birth all the way to death. Is because one thing we know for sure, those stresses that we talked about before are always around us, are always happening, especially physical stresses from poor posture as we sit and we type, and we're typing on our phones, sending text messages, or we're typing on our laptops. All those causes poor posture, can cause inflammation, and cause scar tissue. So what this first study here is the Journal of Clinical Biomechanics. It actually found that if you do not put your joints and your body through a full range of motion, if you not keep them nice and limber and nice and mobile, in little as this study was said, in little as 10 to 15 days, in 10 to 15 days, you'll start to form scar tissue adhesions all around the segments in your spine that you're not moving. All around those segments of your spine. Scar tissue adhesions start to form. So again, it forms a cast around that area. You start to lose mobility. This happens for so many people so often because as they age, oftentimes they realize, wow, I just can't turn and bend. They start to notice when they're turning, instead of turning their neck and head, they actually turn their whole body to maybe look back behind them in the car. So we start to lose this mobility. When we lose that mobility, we lose that drive for proper brain function. But what this study found too, I wrote some notes down here. It said in 10 to 15 days, you can see those scar tissue adhesions and you start to see signs of degeneration in your spine. Degeneration, osteoarthritis, degeneration, breakdown of the tissues. Now let's go back to that analogy I had with the cast on arm. Let's say I broke my arm, I kept the cast on for 6 to 8 weeks. The fracture is now healed, so the broken bone is now healed. But what do you think about the strength of the bones, the density of the bones, the strength of your tendons, your ligaments, the strength of your muscles? Let's say we took that cast off today. Today was the first day we took the cast off. One thing we know about your muscles, in 6 weeks you can lose up to 60% of the strength of that muscle. So that muscle literally atrophies throughout that time. Everybody knows that. Whenever they take a cast off, their muscles are weaker, their arms smaller, or whatever body part that they had is smaller. And so you atrophy the muscles, and you think about the ligaments and the tendons, they get weaker as well. And the density of the bones get weaker because movement is what drives calcium to go to your bones. It's what strengthens your tendons, your ligaments, and it's what strengthens your muscles. So very important to have motion. And so when you get your cast off, you have to rehab that joint and those muscles and those tendons and ligaments. Now, in 10 to 15 days, some studies, just so you know, I don't have them up here, but some studies actually say as little as 3 to 6 days, you'll form scar tissue adhesions. So it's forming that cast in your joints. It's immobilizing that segment of your spine. You start to see degeneration at a very early time. So let me tell you in the next study here. This study right here, the Journal of the American Chiropractic Association, they actually took mice and they put metal wires into their spine, so completely immobilized their spine. But what they found by immobilizing their spine, in 1 to 4 weeks, they found articular surface degeneration. So where these joints meet up in the back, in 1 to 4 weeks, they start to see articular surface degeneration. In 4 to 8 weeks, they start to see something called osteophytes start to form. Now, what is an osteophyte? Most of you have heard of a bone spur. It's a bone spur. The body is literally realizing that this area of the body is unstable. It needs to have more stability added to it. So it's going to start putting more calcium in that area. It's going to put up the calcium all around where those scar tissue adhesions are. And that's where you start to form bone spurs, or what's called Osteo Arthritis. Most people have heard of arthritis. And that can happen in as little as 4 to 8 weeks. Very important to know. So scar tissue will form in 10 to 15 days. Some studies say 3 to 6 weeks if you're not keeping your joints moving. This journal right here says that you'll start to see bone spurs and arthritis. Well, arthritis start to form in 1 to 4 weeks. Bone spurs start to form in 4 to 8 weeks of that immobilization. Now, this is another thing that's interesting here. If you look at the next journal, American Journal of Neuroradiology. In this journal, they actually they did images of people that were asymptomatic. So all ages, from teenage years all the way up into the 80s. So all throughout, looked at people that were asymptomatic, and they wanted to do MRIs of their spine. And what they found with these people that had no back pain, no neck pain at all, they found that people, 20-year-olds, 37% of 20-year-olds actually had degeneration without any symptoms in their spine. Degeneration in their spine, in the disc and in the joints in the back of the spine without any symptoms at all. And then you look at 80-year-olds, it's 96% of 80-year-olds have degeneration. These are people that have no pain. So we know a lot of people that have pain, they come in and get everything checked out. They're going to have problems and issues. But people that have no pain at all, because I hear a lot of people say, well, I don't need to go to a chiropractor because I don't have any pain. I'm not hurting, my back's not hurting, my neck's not hurting, I don't have headaches, I don't have any pain. So I don't need to go. That's also like saying I don't need to go to the dentist because I don't feel any pain in my teeth. We know we need to keep brushing and flossing our teeth. We know we need to eat healthy food. We know we need to have regular checkups to make sure everything is healthy, because your teeth can degenerate without us feeling pain or symptoms. This is the same thing. Your spine can degenerate without any symptoms. With the stresses we have, we can form a lot of scar tissue in our joints that causes osteophytes, or bone spurs, to form and arthritis to form. Just like your teeth can decay, you can have degeneration in your spine, and you can do that without any symptoms or any pain at all. That's why we feel every single person should be checked. and we should be checked throughout our life and continue to be checked and maintain proper movement, because your joints will degenerate. And if you have degeneration, the joints stiffen, they lose that good mobility. If you lose mobility, you lose that drive to your brain, you lose brain function, then you lose health of your body. So your body slowly deteriorates with this. So it's a lot bigger than just back pain or neck pain. This last one here, the Journal of Manipulative and Physiological Therapeutics in the year 2004, this one also found that they put wires into the spine of a mouse, of a rat. They took the wires out. They found that, of course, when the wires are in there, it was over 237% decrease in mobility. Of course, when you put metal wires in somebody's spine, it's going to decrease the movement in that area, of course. When they took it out, what they found is that 237% decrease in mobility, it improved to 47%. So 47% decrease in mobility, but what they found is with time, they kept measuring a week after that, 2 weeks after that, 3 weeks after that, 4 weeks. They kept measuring on and on and on. What happened with time if they never did anything to help improve the mobility in that segment where they had the wires after they pulled them out? They found that it kept getting worse and worse and worse. It became more and more and more immobile and locked up, which caused more and more degeneration in osteophytes and bone spurs, which caused less and less stimulation to the brain. So I hope you see this. The reason why we say, I feel like every single person should be checked if they don't have proper range of motion, if their joints are subluxated and locked up, they should be adjusted because their spine is going to degenerate because they're losing that healthy stimulation to the brain. They should have this done throughout life with or without symptoms, not because it's going to cure everything, but it's going to be that extra step that's going to help improve their quality of life, improve their quantity of life. So let's go to the next study here. Well, actually, this kind of sums up what we just talked about. Whenever you have all those scar tissue adhesions that form in your joints, it immobilizes. It's like forming that cast on your arm. It immobilizes your joints. What that is, I want you to think about it. Here's the name for it. It's called a subluxation. And I want you to think of a subluxation as a movement deficiency syndrome. A movement deficiency syndrome. Remember, again, I've said this multiple times, but I think it's good. Repetition is good to help us understand it. Movement's essential for your brain. Brain is essential to control the body. If you have areas in your body that are not moving properly, you are deficient in that essential stimulation to your brain. It's a movement deficiency syndrome. That's what a subluxation is. You lose that mechanoreception to your brain, you'll start to lose brain function. You'll start to lose body function over time.